record this. I'll still, give an intro to Anna. You obviously have
Yeah.
just met her, but this is our new Thrive doctor, graduate of St. Kate's, graduate of Bemidji State, CrossFit coach, strength conditioning coach. So she's just a wealth of knowledge when anything rehab or strength conditioning related. So really looking forward to her giving this presentation, and I know she's looking forward to it as well. And hopefully you are too, Ethan, and anyone else that watches this. Anna, I'll turn it over to you.
Thanks.
You want to turn on your audio, and I'll turn mine off.
Oh yeah. Or can you hear me now? You'll hear a little thing. Ethan in the house. If you get a tidbit or a takeaway from this, that's the real win, I always say. So kind of just talking a little bit about fixing shoulder pain with overhead lifting. Right, kind of introduced myself, but we got the whole gang. If I just kind of click, oh, there we go. It's catching up. You've met Matt, right, too? So you know the two dudes, but now I'm on board, so I added my photo to the slide. But just I like to say, like, Thrive is a different mission than most physical therapy places. Just we're striving to create a new standard in healthcare through an extraordinary member experience. You really have to think healthcare reimagined. And I mean, the opportunities are endless when you kind of join this team and start working with Thrive. So biggest thing here, we're also passionate about changing lives through movement. I think the world we live in today has kind of that half and half of a lot of people that move and a lot of people that don't, and getting more people up and moving and feeling good does a lot for many parts of our holistic self as humans. So things we'll talk about today, we'll do a little bit of shoulder anatomy overview, a little bit of imaging. Should you get it? Should you not? Is it needed? Causes of shoulder pain, diagnoses, self-assess it, a little bit of some kind of 3 tips to kind of start to fix what might be going on, and then a little bit of a wrap up for final questions if you got any. So little overview. I like to say there's 3 bones connected to the shoulder girdle, filled in by ligaments, the joint capsule, rotator cuff muscles, and the big prime movers like your lats, pecs, and delts. You have your static stabilizers, like I kind of talked about, your ligaments that hold everything. It's a little bit of that glue. And then you get into more of those dynamic structures like your rotator cuff, and then the big global dynamic ones that have that muscle contractile force, right? So it's pushing and pulling when we're going through everything. So
silly question.
Oh yeah.
So
what'd you say?
I have a silly question. You got to go back
Yeah,
one.
go for it.
Go back one.
Go back. Yep.
Yeah. Okay. So the bone on the top there.
Yep.
Clavicle. Yeah. So then there's a joint like in the middle of that bone looking thing.
Yep.
Right in the
that AC
so then
joint.
upper to the left. Is that what that thing is? So it's like right here.
Yeah, you got it right there. So if you've ever seen somebody that, if you know hockey players, typically if they get smashed in the board sometimes, they might have that like drop in that shoulder with those ligaments. If they kind of become detached, you might see that step off deformity. So that's kind of right by that AC joint where all of them come into play. So is that kind of what you're talking about?
Yeah. And then the acromion.
Yeah.
Upper. That like is that the back side of the shoulder? Is that part of the blade bone?
You got it. It's the right part of that scapula right there. So it all kind of comes up, and then that acromion that I'm kind of pointing to is a part of the scapula as well. Yep.
Gotcha.
I know. It's like a nice kind of quick overview of that anatomy phys stuff, but a simplification, I like to say.
Gotcha. Okay. Sorry. Thanks.
No, totally. Any questions, welcome. Kind of getting into it, once you have all these structures, the truth grid of everything is kind of the biomechanics or the science of the, how the muscles, the bones, the tendons, and the ligaments are working together to move your shoulder. So anatomically, it's called the glenohumeral joint, but we just say shoulder joint just to be nice and easy. But it has incredible degrees of freedom. So it's very mobile. I like to say your humerus is a golf ball, and your glenoid, or the other part, if we kind of even go back, you can't even see it there really, but that's like a T. So very, very mobile for us to do everything we want to do, whether that be in our transverse plane. So it's doing rotational movements, the sagittal. So I like to say swinging your arm back and forth. and then getting down into a little bit of that frontal plane. So if you're doing jumping jacks, that's kind of where we're moving our shoulder there. If you couple all these movements, you truly see some really cool things that we do. We throw a ball, we take a slap shot, we do a golf swing, we snatch a barbell. We just simply reach our hand to grab things in different nooks and crannies of our house. So we need that shoulder to really have its degrees of freedom. And when that starts not happening for people, it can be definitely detrimental. So a little, if I kind of click here, what's nice is you can kind of, oops, I would play it. I wonder if it will let me play now that I did this. I have this nice, yes, there it is. So just kind of watching as I talk, you'll see if you really take a glimpse into the shoulder, what it looks like with that scapula moving, kind of coming in with your humerus, that long bone, the clavicle, and then even attached to that thoracic spine. So it's pretty complex if you think about it. We have all those components moving together to create that integral role of the biomechanics that's happening. The scapula needs to be able to move upward and downward, tilt. I like to say protract or push forward, and retract, pull back. Your thoracic spine needs to accommodate your scapula as it glides onto its rib cage. So when any of these aren't necessarily up to par, and we'll talk about it later, it can definitely be a piece of why you might be feeling a little bit of shoulder pain. With that, we'll segue into just when you see something anatomically, or when something happens kind of anatomically, physiologically, or biomechanically, and we have those pain signals happening and they're alerting you, the first thing you might, people think is, I need to go get this image. I need to kind of look into my shoulder and see if everything's, okay. But I kind of want to divert people that way a little bit, just because there have been some studies that you can have significant structural pathologies or differences, but not show any signs or symptoms. There was a study in 2010 by Flanagan et al., kind of examining a little bit of more at the knee joint, but it had a bunch of athletes, 931 athletes, and they found that 36% of those athletes had a little bit of cartilage defects in their knee, but only 14% of those people with defects didn't have any symptoms. So it's not always to say that the image is always going to correlate with what you're experiencing in your shoulder, which is why I just want us to be a little bit careful of, when we choose to get an image. And we definitely wrote this here. So if you have a major trauma, like I talked about earlier, getting checked in the boards, you have a little bit of a step off deformity or something, or, other things are kind of happening where you can't even raise your arm overhead at all, or you're having significant weakness. So I call it extreme motor difficulties. That definitely is to say, let's go get that checked out, even dislocations, because that's pretty, we might have to go into more of that surgical option. So when in doubt, at least get it evaluated by a professional. Now, kind of segueing, this picture I really like. I know it's like a tree and roots, but it helps kind of elaborate on the fact that there are many potential root causes of shoulder pain, specifically with overhead movement. If we just even segue into that niche area, I think it's important to consider the uniqueness of us as humans. Some things we can control, of course, but some things we can't. In regards to the shoulder, we can't really control, I like to say we're born looser. So some people are just born a little bit looser. You ever watch Michael Phelps do his arm swing? He's got amazing mobility, but sometimes that can come into play where some other things in the shoulder kind of nag at him, probably, because maybe he was born a little looser. Or sometimes we have an injury and we're now what used to be a really solid capsule is kind of stretched out a little bit, and we worn ourselves a little bit loose. And I like to say too, not all of our bones are the same. So that ball and T that I talked about, that humerus and then your glenoid that kind of fit together, everybody is differently structured, like a skeletal system. So things might not fit in congruency. So it's just important to take that in a note. You're not going to be the same, or I'm not going to be the same as Greg, and Greg's probably not going to be the same as me if we really dive into our shoulders. So this one there. Yeah. So basically we're kind of thinking of causes of the shoulder pain that we mostly see. It's you either have kind of poor movement patterns, technique or form, and we kind of move improperly, but we think we can get away with it and it kind of catches up to us. So we start kind of having that pain or that discomfort happen to our shoulder. Mobility limitations many times generate from like the rotator cuff, your lats and pecs, and even your thoracic spine, which we'll get into how to assess that. Strength, stability, and coordination is super important, especially of your rotator cuff and your scapular stabilizers. The primary movers, just like your delts, are very important too. You want them to be big and strong because everything kind of has to have that strength to take a little bit of weight off of the other stuff. So if one's a little bit weaker and one's a little bit stronger and one's giving you a little bit more of a pull or a push, that can definitely be a key component of why you might be exhibiting some discomfort as well. And then even that coordination that I talked about, your muscles all have to kind of fire in congruency at different times. So if things aren't coordinated, that can also be a kind of leading cause. And then finally, that overload and under recovery. I like to say, you know, the rotator cuff definitely gets the brunt just based on where it's located in your shoulder. But when you overload it time and time again, just based on how much weight you're doing, and your body doesn't recover well, whether it's sleep or how those muscles repair themselves, or just, I would like to say, like, you're just continuing to fill the bucket and that bucket's overflowing, you can have that injury. So. Did that mix? No, that's common. Perfect. Okay. Now kind of getting into those diagnoses. So I like to say there's definitely movement. There's deficits that we see, whether it's like the strength, the mobility, the stability, kind of that capacity overload, but then we kind of put it in a little bit of a diagnoses box. And these are things you might see. So if you're kind of overloading and under recovering, you might see a little bit, like I said, at the rotator cuff, your biceps, and, you know, those rotator cuff tendons can definitely get a little bit, I like to say they're a sock. And once you start kind of fraying at them a little bit, that sock can get a little bit of a hole or a fray. And over time, it can lead to a little bit more of those tears and like greater tears if it's not addressed or you're not having that proper kind of ability to settle down your symptoms and you're just continuing to overload. And then when we talk about the poor movement patterns, the coordination, strength, mobility limitations, we might see a little bit of shoulder impingement, or I like to call it SAPS, subacromial pain syndrome, just because of where all those structures are in your shoulder. It's underneath the roof. And we talked about the acromion, but it's basically a roof and all those structures kind of come underneath, and a lot of them can just get irritable. So that's what we talk about. Like it's kind of pinchy or impingement, or we say SAPS. Scapular dyskinesis sounds scarier, I like to say, than it is. Basically, I just call it poor scapular positions and movement patterns, which in turn can make up, like, can move up the chain to the shoulder. So we talked about everything being connected. If your shoulder blade just not working the same as your other one, it can just lead to some other problems going up the chain. And then finally, even the labral tears. So in the actual joint itself, your labrum really helps kind of that suction or that stability, besides some of those like ligaments, tendons, rotator cuff, all of those other things. And even a little bit of a tear that you exhibit can create a drop in pressure. So that creates that instability that's happening in that capsule. So it's not to say you have a labral tear and you need to get it fixed, but it definitely leads to a little bit of that instability and possibly some shoulder pain. So it's a diagnosis in itself that you might see. And then we call it adhesive capsulitis or a frozen shoulder. That could be its own presentation on another day for some people that happens. So we'll just kind of keep going. So and this is fun stuff. Oh, yeah.
Go back. Couple questions. Yeah. Might be silly, so forgive me. Tendinopathy. So tendon badness. Tendon hurt me.
Yeah, right? I like to call it tendon irritability because it's like, we call it like tendinitis, tendinosis, tendinopathy. It's like, how many like words are we going to use? It's like that irritable tendon kind of thing. It just gets overloaded, overused.
Gotcha. Okay. And impingement meaning like literally things hitting that shouldn't be hitting.
Yeah. Like the space, it's like thinking about the space getting smaller and like over time, right? Like because you have so many things underneath that, if we go way back, that acromion or that piece of the scapula that comes is kind of like the roof. And then all those, like, we have like a bursa, we have like your rotator cuff tendons, we have like some ligaments around there, we have the joint capsule. It's like all of that is kind of surrounding, but there's things underneath the biceps tendon that fit under kind of that roof. And as we move our shoulder in different positions or load it in those different positions, some of those components just can get really irritable as well. So it's trying to stem, where is your symptoms of discomfort or pain stemming from? Is it more of that pinch, or is it more of that actual, like maybe you have a little bit of a tear? It's not to say you have a tear, you need to get it fixed, right? Or is it like leading from your rotator cuff, your biceps? It's kind of just uncovering where is your symptom generating from. But sometimes we just call it SAPS because we can't pinpoint what structure it really is coming from. And we have to say, okay, there's an array of structures, and one of these or a group of them are becoming irritable in that area. Does that kind of clarify that?
Yeah, thank you.
So the fun stuff is kind of that self-assessment. If you're someone like that's dealing with any shoulder discomfort or pain, it's your place to start. It's kind of like your DIY. So first and foremost, perform a movement screen. Look at the big picture. We like to do this when you come into Thrive, but that's the big thing. You can't look at one site and say that's the reason. You kind of have to look globally. So video record yourself performing like an overhead movement, whatever that might be. Even a snatch is an overhead movement, right? Some type of thing. Use a PVC, a barbell, hockey stick, whatever you got at home. Get a front, I like to say, a side, and even a back view. And you can just record it, like repeat it 5 times, just because sometimes the first one isn't always the best, or we're getting kind of used to filming. So do a few times, do it at your regular kind of normal movement pattern, and then assess yourself. With that, observe, I like to say, from your wrists all the way to your low back region. And then on this side is just some places to look and start to observe at, and I'll kind of talk about them. But having a sports bra, a tighter shirt, your tank top, anything that you can see your shoulder blades move is really nice, because again, that's a component of the shoulder. So being able to see that from that back view is going to be important. If your pain is decreasing, I like to say, when you correct any of these movements, that might show me automatically that this is the area we're going to start. Yes, we'll get into the other things, and that's still important to keep your shoulder resilient. But this is kind of that key thing that if we can fix 1 or 2 little things, you might just be like, wow, I don't even feel it that much anymore. And that's like the best sign that we could have. So if there's pain, at what point in the movement and how intense is that is something to kind of note. You could write this down, take it, bring it to us or somebody else. Is the implement, for example, your barbell near or on your shoulders when you're initiating the movement? And then are you pushing the head through at the end of the movement? Sometimes, a lot of the time when we're pressing a barbell over, our head doesn't like to come through, the bar is coming out, and we're overloading that shoulder joint just because of the sheer fact that we're not even close to our center of gravity or our belly button. Does one arm press or lock out quicker? I like to say some of us, we have dominant sides of our body, and like one side just feels a little bit stronger, feels a little bit more stable. I get that. We're not always symmetrical, but over time, just like this dude on the right, if we're pressing like that, I'm sure something's going to catch up to us at one point. So that's something to look at. It might be subtle, so kind of slow-moing it is going to be great. Does one of your shoulder blades move a lot, or possibly a little bit faster, or maybe not at all? That's kind of nice to see. And then from the back, is your shoulder kind of winging out? Sometimes we have a little bit of our shoulder blades that have some winging symmetrically. So maybe that's not as much, because when we have to move into like internal rotation of our shoulder, if you like have to bring your arm back, we might start seeing a little bit of winging, and that's not abnormal, but excessive of any kind of leads me into an area that might be needing to be addressed. And then I like to say, like, what does your shoulders look like? You know, are they rounded? Are they forward? Are they like extended back? All of those pieces are going to play a role in why we might be seeing some of the things or feeling the way that we do when we're pressing. So questions on that?
No, thank you.
That's a lot. Yeah, it was a lot kind of at once. So we can definitely dive in at the end too. Here's our second little kind of step to look for that self-assessment, mobility. So this is huge for everybody. I see it time and time at the gym, even with like front squats. It's just like, we don't have that front rack mobility. And then our wrists get like the inevitable load of everything because we can't get it onto our shoulders or our big deltoid. So same thing goes for overhead. If you're seeing a little bit of that lat or, you know, pec, these are ways to assess that. So if you're doing the overhead PVC on a wall, it's great. Greg's got wonderful mobility here. So if you're unable to pass it with your palms down, what you're bringing that shoulder into is a little bit of that internal rotation. So it's going to assess a little bit more of your posterior cuff being tight, possibly your pecs or your subscapular muscles. If you bring your palms facing you, kind of that supinated grip, that's putting those lats in a little bit of a tighter position. So you're able to see if that's more of a restriction coming from there. So that's probably the best way to kind of look on your own. And then kind of just assess if any of those are, if both of them are difficult, sometimes it might be coming from the joint, and we kind of think maybe we need to mobilize the joint a little bit to see if we can increase the degrees of freedom that you can reach. So if both are a little bit, maybe it's coming and stemming from a little bit more of the joint.
And the one on the left, that's what, like, his hands are like this, from the side.
Palms down. Yeah, as long as your palms are down, don't, like, it doesn't have to be curled or anything. I like to say just kind of, as long as they're facing down, grabbing the PVC and then keeping a little bit more of to kind of the hip width, it keeps it standardized. So if you constantly are like taking your arms and widening them, of course, that's going to allow you a little bit more of that ability to get overhead. So time and time again, to reassess, I would say keep it consistent by just keeping it close, kind of like what you would have for your hips width, and then bringing the bar or the PVC. You would not want to put a bar like this over your head. The other one is, I like this, the functional internal external, especially if you're someone that's weightlifting, snatching, you name it. Seeing where that, like, you can take just a photo, or I like to say use a photo timer if someone can't take a photo of you. It allows you to see where that's going to be, kind of where your fingers lie. So Greg right here, you can kind of see he's kind of, his scapula is right here. He's kind of the end of his scapula for internal rotation. And then definitely, this is why we have loofahs, because half of us can't reach behind our back. So you can kind of just pinpoint. It's more of like, is it symmetrical? If you're having pain in one of your shoulders and one of the sides is less symmetrical than the other, that's kind of pinpointing some of those mobility, possibly being a way to fix it or be an aid in fixing it. It might not be the full solution, but it might be a part of it. With that, you know, if you're unable to pass kind of that first test, we say it's a little bit maybe more of the back of your shoulder, capsular cuff. And then if you can't reach kind of behind your neck, it's the front, just for a general scheme.
And when doing this, do you put your shoulder blade or shoulder back down kind of thing? Like, do you?
I like to say, don't worry so much of like the exact mechanics of how you're doing it. Just like pretend like you're just like reaching for something behind your back. See how far you can kind of like maybe creep a little bit. You'll definitely know when you can't go far enough. Like there's just a point of no return where it's like, that's the end. Take a picture of that, or have that set on a like a photo timer, and then see where each side kind of lands. Now, when we're getting into the mobility of your thoracic spine, this is a really good kind of test. We like to say 55 degrees. It's kind of hard to calculate. So again, this is more of set yourself, have someone take a picture or set up a timer just to see if there's any differences. If you set yourself up in the exact position, are you able to kind of rotate a little bit more on one side versus the other? The T-spine or your thoracic spine is pretty stiff just because it has to protect all your vital organs. So we're not saying we want it to be extremely mobile, but if we're seeing that one side's a little bit stiffer than the other, that could be another route that we're going to kind of address some of those shoulder discomfort. All right, getting into a little bit more. This is big because I think external rotation for many, many people, or internal rotation, can be a big part to why they're having some of their symptoms, just because it's weak side to side differences. So I think the best way, you can do this at your side, so you can do it here or a little bit out, but I think the best way is 90-90, meaning you're really putting your rotator cuff in a position that has to work hard. So just like this, have someone resist you. Just up there, you can do it. If you see kind of how the hands are placed, one's going to be pushing you externally, and then one's going to be pushing you internally. And you can kind of see side to side differences. If one side feels a little bit weaker in one way or the other, that's good to know as we get into more of the intervention strategies of how you can treat that.
We've done this, Greg.
Yep.
Are you weak?
With the external.
No, I'm not weak.
No, you are strong. Yes, exactly.
Yeah, we've done a couple of these. Yep.
Perfect. Well, another little area, like I said, rotator cuff and scapular areas are definitely weak on some people. We just don't train them enough. We like to train the big global movements, which of course you're still utilizing these little kind of smaller muscles, but they don't come into play as much. So it's just kind of nice to see, can you sustain for this prone Y and prone T? I like to say about 20 reps. Yeah, you could have someone press on you and see if you give out, but maybe a little bit of endurance in these muscles are important too. So just seeing if you can do the same height, you can film yourself each time, 20 reps, or see how many reps you can do, would be kind of nice to just do a before and after. So maybe you can only do 10, you start strengthening your, this is even the first place to start because it's body weight. So you can even strengthen this way, but you start strengthening, and then you notice that you can rip out 30, that's showing that you have progress and you probably already increased your endurance and strengthened those muscles. So see where you start, see where you land, see where you get kind of tired, and then reassess over time as you start kind of that intervention strategy to strengthen them. Oops, I still flip fast. The last kind of screen that I have is just this load screen. So a little bit different when we talk about other body parts, but ways that I kind of approach a load screen with your like upper extremity, whether it's a push or a pull, that can be kind of helpful to tease out which movement and how much load begins to kind of recreate your familiar discomfort or pain is this. So I kind of gave an example that you can, start a set of 3 reps with a barbell, and I'll talk a little bit more. That doesn't have to be a barbell, but start at 3 reps with a barbell, add like 10 pounds. You can make faster jumps early, 2 to 3 sets. If it still feels good, then continuing adding 5 pounds until you kind of feel that discomfort gives you a little bit of that, I like to say, span of knowing where you feel really good and where it's not. I don't want you to be like debilitated or feeling really crappy the rest of the day because of this, but where it's kind of starting the trend of where you're like, oh, I kind of feel it there. It just gives you an idea when you're coming into the gym that you don't have to stop pressing just for the sheer fact that you're having a little discomfort. It might be more of a load thing that we have to work over time and then reload. So I would say this gives you an idea, like if it's programmed, you kind of know where you can fit in the ballpark of the weight that you can put on the bar for that day. I like to say in PT, you should never hear you should stop doing things. It's kind of finding that way to modify things. So with that said, some people will say that just having a barbell is a lot harder. I think kettlebell and dumbbells might be a little bit easier sometimes as you're pressing. So that's another intervention strategy, but you can assess if there's any differences when you do this with a barbell, a kettlebell, or a dumbbell, because that will also find you in that niche spot of modification and what tool to maybe use for that overpressing when you're trying to combat some of those pain symptoms in your shoulder. So I like to say, because of our fear of kind of recreating, we completely stop loading, which usually is not the way to go. So if you ever have questions, again, we're always available at Thrive. And then over time, test and retest is really great, where sometimes if you perform some of the exercises I'm going to show you below, and then you do some of these loading strategies and you don't feel, or you can go heavier, that's giving us an idea that maybe some of the culprits are maybe the stability over time, the strength, and other things, because your shoulders just aren't warm to begin with. I've had that problem plenty of times. So creating that kind of prehab program might be in the cards. This is the fun stuff where you can actually start improving some things. So here's some starting tips. I think that will be good to kind of help fix your discomfort or pain. First and foremost, if you're having mobility restrictions, it's great to either do some of these kind of stretches that Greg's performing, whether it's a lat, a little bit of cross body, pec, or even if you can see kind of that upward, I like to say that you're doing a little bit more of kind of that posterior capsule stretch as well. That can be good. If this last one's a little pinchy for you, because sometimes it is, or that impingement kind of happens, the cross body or the second photo is probably your best bet. It's still going to stretch what you need. It's still going to feel pretty good. A lot of times with these stretches, I like to say a minute or more, just because we don't make some of those changes in just 10 seconds. So if you're just hanging there for 10 seconds and hoping that it's going to make that flexibility change, it doesn't work that way, I like to say. So about a minute and a half each side, definitely you can see some improvements, and do those retests from some of those self-assessments above, like where we did that wall to PVC. If you see that after you do this for a minute and a half on the left and your lat and you're already kind of like flexible or a little bit, you can get higher, that's showing that you're on that right track. So retest is really important to think about. If none of these are really working, and I talked about the joint sometimes being a little bit of that stubborn nut that likes to hang around and you can't get after it, banded joint mobilizations are another great option for improving that mobility and addressing some of that tightness you might feel in some of the areas of your shoulder. The second thing to kind of get after is improving shoulder stability. So 4-step process, I like to say in the first one, we're creating that good base. So that scapular stability and the rotator cuff is going to be that kind of foundational piece. And then with that, you get to learn to load overhead and progress to more control and awareness. And we'll talk about it. So improving that scapular stability, all of these that I kind of have set, we're doing higher volume reps. I think that's important here. You're not necessarily doing things with really heavy weight. It's definitely a little bit lighter weight, or maybe even body weight sometimes. 2 to 3 sets. Here are some options. Kind of what this is fun. It's I like to say these aren't always the sexiest movements or the most enjoyable to do. You're like, oh, do I have to do these? We can make them fun, and that's the creativity that I like to bring to the table. But you can see even here this woman on the left, she's doing stuff where you can kind of make it fun, where you're clearing cones, getting a little bit, working in all directions, almost like a time clock. The second one, if you're kind of working into that plank position, you can push your head through and then get a little bit more of your serratus muscles for that shoulder blade, as well as some of the other muscles. This is a really good one for the serratus. And then if we look on the left or the right, the far right, it kind of looks deceiving, like, what is this person doing? By putting those thumbs up and kind of pressing up, you're actually engaging quite a bit of your lower trap. So this is another great option to just, again, get after those scap stabilizer muscles. Rotator cuff, we like to say, again, these aren't always the most enjoyable, or they don't look the most fun, or the truth is we can kind of make them more creative, but this is a starting foundation. So here we do a little bit of internal 90-90, little external position here on the right. I like to say the rotator cuff is important because it holds your humerus and your glenoid together, right? It's kind of that cuff, we like to say. And when you're doing all of your activities, you're still doing pushing and pulling, and that's still going to enable that rotator cuff to like have to stabilize. But when you do some of these other ones up here, it's nice in those higher volumes because it really activates them specifically. So I tell people, you're not wrong if you do some other movements like push-ups, things like that. They're still working because they have to keep your humerus stable into your glenoid or that ball and tee. But I mean, if you really want to like target them, these are kind of the starting point, and then we can kind of get fancier and more exciting down the road. After these kind of foundational movements come in, it's kind of learning to hold the weight overhead. So 2 options I even just brought out here. If you have a landmine, if you don't have an actual thing to put your barbell in, use like just like a towel so you don't wreck anybody's wall. Put it in the corner. And then what you can do is I throw it as, probably with a landmine, you'd be doing like 2 or 3 sets of a 10-second slow 3 to 5 eccentric concentric. So what happens then is you're slowly loading yourself above your head and finding the positions there. and then you're slowly loading down. So as you get 10 on your right and you're doing that 3 to 5 seconds at a time, you're going to definitely feel a good burn. So you might not be loading that barbell super heavy. And then you just switch the other side. This is really good. Just get that stability after it. This is probably not where I just be like, okay, hold it for 45 seconds over your head. This would be a motion that I would be like, do tempos. On the right, where Greg is, this is great because those upside down kettlebells are super great for stability. Your shoulder is definitely gonna feel unstable when you put it in higher positions. So as you bring it overhead, what you can do is you can do presses, which create an unstable environment and becomes hard because it's dynamic. And you can also make it static. So at the very top, holding that kettlebell over your head, 30 seconds, maybe even 45 seconds. I know that's kind of aggressive, but it's great because what happens is if we just hold something for a few seconds, like anything, it's going to still feel kind of easy, might get a little bit harder, but we finally at those later lengths of the movement, we start to like get the dynamic musculature coordinated and responding. So it really has that effective time where it's in the later stages of actually the hold. So just holding 10 seconds might not do the trick. Giving that more of that 30 to 45 seconds can be a better stimulus. And then finally that progress control and awareness. So we like to say like perturbations and people are like, I have no idea what that is. I'll kind of talk, but some of these can definitely be a challenge where you're working at higher speeds and then inconsistent feedback. So that's kind of that perturbation. Here on the far left, if you have someone kind of pressing you with that ball, it creates the unstable environment. And then your shoulders kind of having to dynamically move while people or somebody puts a little bit of a different force in different spots. So that's kind of where that inconsistent feedback comes in, and your body has to make awareness and try to stabilize as that's happening. The middle one, this is definitely a harder, I would say, a harder progression, but kind of fun. We're doing that bounce and kind of moving, challenges you because the ball is moving, and then you're going to have to do, again, that inconsistent feedback and stabilize. And the last one I really like, I saw this, these are some from online, but it's a shoulder slingshot. So I talked about faster speeds. Learning to control movement in like quicker ranges and faster speeds is really important too, because a lot of the activities we do require this. So what you would do is you would hold that band and then you would let it go. Your shoulder's going to kind of shoot up, but you're working on that control. So start probably with a lighter band so that you can have it, and then you can build up into a little bit more resistance as you feel like you get the hang of the movement.
You're like, kidding, letting go and letting your shoulder.
I want to see this at everybody's trying this out at their next gym. Okay. Everybody lined up on the wall, throw it on the rig, and then everybody doing some shoulder slingshots.
The bottom one, that gentleman is dribbling.
What did you say?
The guy on the bottom is like literally dribbling a med ball.
You got it. Yep. Kind of in that quadruped position. So it's nice because you're loading that right shoulder, but at the same time, that left shoulder is having to then deal with that inconsistent feedback, trying to feel where the ball is, where it's going. So I really like that. And that's kind of that creativity we talked about where, in the beginning, that foundation has to be established. You have to get things stronger, but then we can get kind of fun and we can kind of do some things that like you don't expect or get really creative. So the final tip is keep pressing. I think like I reiterated, or I'll reiterate it again. We get scared or we get a little bit more fear avoidant when like we have pain and we think, oh, I shouldn't do that motion anymore. We're great tools and resources to come to talk about this, but keep pressing, find ways, like I said, kettlebell, dumbbell, barbell, finding ways or potentially your load of where you can kind of press is important. Don't stop doing something you love just because that pain's coming. There's definitely modifications. So I just like all these pictures because there's so many ways to press, whether like I said, it's that press in the snatch, you're doing some jerks, cleans, or I mean, just in your daily activities, right? Doing anything. I don't know. Can we give an example? What's a good example of like a functional everyday? I'm in the gym so much that this is what I see.
Playing with your kid.
Yeah, playing with your kid, like press Simbaing your child up in the air with a nice press, right? Like this all comes into play where you might have that shoulder pain because your kid starts getting older and bigger, and then you have more load that you have to press over your head. So with all that said and done, I like to say the shoulder is really unstable in a way because it's that humerus, that golf ball, and that T, that glenoid. And we have all those static and dynamic structures that are trying to hold it together through life. Some of those things through just age or maybe traumatic, kind of events where we land on our shoulder or something happens, or even you pull a weight off the ground and something just feels a little bit looser. All of that can create instability over time. So what's already unstable becomes a little bit harder and a little bit more unstable. And then we start exhibiting or having a little bit of that pain. So lots of issues that can kind of cause that. And it's important that you have someone like ourselves even guiding that recovery. So always ways to self-assess, but it can be confusing. So if you need someone, or if you know of someone dealing with it, or yourself, don't ever hesitate to reach out to us, because I like to say we really have your back. We want to get everybody back to doing what they love. That's the most important thing about life and why we all got into this profession. So you can scan that QR we have like a 30-minute, or we have a 30-minute discovery visit. You can just come in, we can kind of assess what's going on a little bit and make a plan for our future together. So here's all of our information. If you ever want to visit our website, Instagram, call our phone, or even email us. Like I say, Thrive's got your back.
So, couple of questions. Can you go back like 4 or 5 slides? There was one where keep going. We're beyond 5 now. I recognize.
I know, I was like 4 or 5.
Yeah, my bad. Keep going. Oh,
right there.
No, it might be farther. It's when you talk like progressive loading, but you didn't use the word progressive. I like the other word.
Ooh, maybe I brought that over.
Yeah. Screening, movement screening, which essentially like do things, but do them heavier until you feel some discomfort.
Oh yeah, it was right here. Yeah.
We're back.
Right here.
That one.
Yes.
Okay. So I like that. Right. So don't stop doing it. Just do it until it doesn't necessarily hurt, but aware. And then perhaps the takeaway is that awareness of pain should go higher and higher and higher.
Yeah. Like over time, and it's kind of like in compilation to your rehab. It's like, okay, you found out where your areas of discomfort is. Maybe it's not your technique. Maybe, like I said, it's kind of that rotator cuff getting, or like other structures getting really irritable, like your biceps tendon, even because it attaches like way into your shoulder. And what happens is everything's getting loaded. It gets irritable, but it only gets loaded at 150 pounds, right? I'm at 100 and I feel great. It's like, okay, I feel great at 100. 150 is kind of my like, oh, it starts getting a little angry at me. That's where I can kind of fit. And then over time, you're doing all that rehab stuff and kind of, getting it feeling really stable, really secure, feeling better. And then you notice, okay, now I don't feel it till 175, right? So it's like showing that progression and that remeasure over time that you can even do at the gym, just by kind of having that written down or mentally written down of where that stopping point is currently.
Gotcha. Okay. And in these range of slides too, you talk about, it's a pretty stupid question, the deltoid. Is that the one right here?
You got it. I don't know if I have the big meaty muscle, but when you see people with some pretty nice deltoids, you can tell. So
go to the one where everyone was jacked, the slide where everyone was jacked on the bottom.
Oh yeah, that should be at the very end one. All those high end like athletes.
Yeah. Like lifting more than,
There we go. Oops. Yeah.
That one. Okay.
Well, you can't, it's kind of hiding, but you have that posterior deltoid. So you got some in the back. You can see, Chandler Smith a little bit more.
Yeah.
Right here. Trap.
Good. My.
And, yeah. Oh yeah. This person you can't tell.
Yeah. He still looks great.
Oh yeah. Really good form there, to be honest. Like amazing. No, but yeah, I like to say a lot of the time people think it's always just because of the rotator cuff, and that's where it's like trying to decipher, because some people just like need to get stronger in their shoulder to begin with, whether it's the rotator cuff or even deltoid, right? If the deltoid's a big muscle that's like helping offload some of it and that's weak, that's showing me like, okay, the full global shoulder needs to just get stronger through time. And sometimes, you know, us as PTs, we're also deciphering, okay, what's the best program to kind of give you to really beef up some of those muscles so that they feel really stable. Your shoulder feels really good and you feel really confident performing movements.
Gotcha. And these slides, will they be in a format that can like we can print or?
Yeah, absolutely. We can even send that out just to anybody that wants to kind of like peek through them. And then we have that video. So if anybody needs to like wants to watch it, we'll post that somewhere just for like future. Cause I know it's like hard within people's days to get at like, you know, see all this stuff. So
Yeah, we'll have the video available and then we will be able to send out slides. We'll put something on social media. It'll say, if you missed today, here's the
at
video,
any time you can
here's the
kind of watch.
slides,
Yeah.
and then I'll just send you the slides personally too.
You're
Cool.
gonna know what to do right off the bat. Or if you ever need somebody, you know who to call. Thrive, got your back. Well, it's true. I like to say so many times, somebody just tells you to stop doing something, right? You go, oh, well, just stop doing it. It hurts. Like, but I don't like, I want to go to the gym and be with my friends and do the things they're doing. Like, how do I get back to it? Right. So I'm in that lane. And I think all of us, Greg, Matt, Thrive, that's kind of our lane. And we see that. So that's why we're kind of bringing attention and bringing some of these educational things out there, because we've seen it or heard it, and we kind of want to break some of that stigma or stereotype to it. So
And we'll try to make these somewhat regular, like next week
yeah,
we're doing.
we'll do knee stuff next week. And then if you ever want a postpartum strength training, it's always an option. I'm going to throw that out in a couple of weeks too.
Yep.
Always
Smart
have
on that.
education.
That's for when we have babies. I don't.
Exactly. Everybody can be educated on it. No, but thanks for joining, Ethan. I really appreciate it. And great questions.
Yeah, you're welcome. And yeah, thank you for your time.
Yeah. I hope you have a great day.
Thanks. You as well. See you later.
You're around.
See ya.
Bye-bye.